Welcome to Living Anatomy. This video is dedicated to the second muscle practical. We will be using yoga and Pilates exercises to experience the muscle origin, insertion, and action. Please be mindful as you move through this practice, and if anything feels uncomfortable or painful, please stop. Feel free to move along with the video as you're instructed through exercises, or if an exercise seems a little confusing, watch it first and then go back and do it with the video. If you'd like to skip ahead to a specific muscle, you can use the table of contents that's at the beginning of this video, and it indicates which muscle is covered at what time during the video. It also might be helpful to have a couple of props around, so like a yoga block, or if you don't have that, a textbook or a stack of blankets or towels, just to help everything feel a little bit more comfortable. And I'll let you know when it would be appropriate to use these props. So let's get started. The first muscle we will experience is the gastrocnemius, or your calf muscle. The gastrocnemius originates at the medial and lateral condyles of the femur bone, and it inserts onto the calcaneus via the calcaneal tendon. Another way of thinking about that is thinking that it inserts onto your heel via the Achilles tendon, but make sure you know calcaneus and calcaneal tendon for your practical. The action of the gastrocnemius is plantar flexion of the ankle, so it points the ankle, and it also flexes the knee. To experience the action of the gastrocnemius, come to a standing position at the center of your mat. Bring your feet all the way together. Then bring your hands onto your hips and sit the hips low, like you're about to sit into a chair. This is Utkatasana, or chair pose, from yoga. If you'd like to challenge your balance a little bit, reach the arms overhead, but keep sitting the hips back. So this demonstrates our knee flexion action of the gastrocnemius. Then straighten your legs and bring the arms back to the hips. To experience the plantar flexion action of the gastrocnemius, keep your legs long and rise your heels off of the mat. Then slowly lower them back down to the mat. Control as you lift your heels up off of the mat, rise very high, and then slowly lower them back down to the mat with control. Do this a few more times, lifting your heels up and lowering the heels back down. This time, as you lift your heels, try to balance there. If you'd like to experience both actions of the gastrocnemius, keep your heels high and bend your knees. So you're in a chair pose with your heels lifted. If you'd like an added challenge for balance, lift the arms overhead. The knees are flexed and the ankles are in plantar flexion. To come out of this, bring your hands onto your hips, keep your heels high and straighten your legs. Then with control, slowly lower your heels back down to the mat and come back to your standing position. Try this sequence a few more times to really feel how the gastrocnemius can work and be challenged. The sartorius originates at the anterior superior iliac spine of the ilium. It inserts onto the medial proximal tibia, and its action is to flex, abduct, and laterally rotate the hip, as well as flex the knee joint. To experience the actions of the sartorius, we will be doing tree pose from yoga, or vrikshasana. So come to standing on your mat, feet just underneath your hip sockets, and hands on your hips. Become very aware of your right foot. Make the leg long and strong. And then draw your left thigh bone up towards your chest. This flexes the hip. To laterally rotate and abduct the hip, draw the thigh bone to the outside of the room. Then you can place your foot either on the thigh, down by your shin, or towards your ankle and try to balance here. Just make sure that you don't place your foot on your actual knee joint. Bring your hands together in front of your heart as you balance here. Notice what's happening with the left leg. The hip is flexed, it's abducted, and it's laterally rotated. The knee of the left leg is also flexed. All of these are the four actions of the sartorius. To come out of this, just lift the knee, bring it back to parallel, and place the foot back on the mat. Next, you can shift your weight onto your left side and float your right thigh bone up, flexing your hip. Laterally rotate the hip and abduct the hip. Then flex the knee to place the foot on either the thigh, the calf, or the ankle. Bring your hands together in front of your heart and balance here. This time noticing how the right thigh is using the sartorius to flex the hip, to abduct the hip, to laterally rotate the hip, and to flex the knee. To come out of tree pose, bring your hands back onto your hips, lift your knee and softly place the right foot back onto the mat and come back to your standing position. The quadriceps femoris group is located at the front of the thigh and is made up of 4 muscles: the rectus femoris, the vastus medialis, the vastus intermedius, and the vastus lateralis. These 4 muscles share a common action. They all extend the knee. The rectus femoris also flexes the hip. Because these muscles share this common action of knee extension, we will experience them together. But first, we will talk about them individually. The rectus femoris is the most superficial of the quadriceps femoris group. It originates at the anterior inferior iliac spine and inserts onto the tibial tuberosity and the patella. Its action is knee extension and hip flexion. This is the only muscle in the quadriceps femoris group that does hip flexion. The vastus medialis is the most medial of the quadriceps femoris group. It originates on the linea aspera and the intertrochanteric line of the femur bone and inserts onto the medial patella and tibial tuberosity. Its action is knee extension. The vastus intermedius lies underneath the rectus femoris and in between the vastus medialis and the vastus lateralis. It originates on the anterior and lateral proximal femur and inserts onto the superior patella and the tibial tuberosity. Its action is knee extension. The vastus lateralis is the most lateral of the 4 quadriceps muscles. It originates on the greater trochanter, the intertrochanteric line, and the linea aspera of the femur bone. It inserts onto the lateral patella and the tibial tuberosity, and its action is knee extension as well as stabilization of the knee. The quadriceps femoris group has a common action of knee extension. They also have a common insertion point, which is an aspect of the patella as well as the tibial tuberosity. So hopefully that makes memorization a little bit easier. To experience the actions from the quadriceps femoris group of muscles, we will be doing Warrior 2 or Virabhadrasana 2 from yoga. Come to the center of your mat and place your hands on your hips. Step the feet out wide to the sides. Take up a lot of space. Then turn your right toes out so the right toes face the front of your mat. Keep the left toes pointing to the side of the mat. Now bend your right knee. Make sure that the knee stacks right over the ankle, but not past the ankle. Then you can reach your arms out to the sides in a nice long wide stance. This is Warrior 2, Virabhadrasana 2 of yoga. Stay here for a few breaths. Keep your left leg long and energized. Then straighten your right leg all the way. Rebend your right knee, coming back to Warrior 2. Do this a few more times. Extend your front knee, then rebend your front knee, bringing yourself back to Warrior 2. As you move, notice that as you extend your front knee, the entire quadricep group works to make that action happen. As you rebend your front knee, you are also flexing your hip, and this is the action of the rectus femoris. This time keep your right knee bent and stay in Warrior Two for the last 3 breaths. Then straighten your front knee, bring your hands back onto your hips, and turn your right toes to face the side of the mat. To come to the left side, turn your left toes to face the back of the mat. Reach the arms out to the side and bend your left knee. Keep your right leg long and strong. Notice that the back leg, when it's in this position and it's energized, is also using your quadriceps femoris group to keep the knee extended. Now extend your left knee. Then rebend your left knee, allowing the left hip to flex as you return to Warrior Two. Do this a few more times, extending your left knee, rebend the left knee, flexing the left hip, coming back to Warrior Two. As you move through this, notice how the vastus medialis, lateralis, intermedius, and rectus femoris all work to extend the knee. Also notice how it's just the rectus femoris that flexes the hip when you come back to Warrior Two. Stay in Warrior Two for the next few breaths and notice how the muscles of the front thigh and the muscles of the back thigh feel. To come out of Warrior Two, extend your left leg, place your hands on your hips, and turn your left toes to face the side of the mat. Then you can heel toe your feet underneath you to come to a standing position. The gluteus medius originates at the lateral surface of the posterior ilium. It inserts onto the greater trochanter of the femur bone, and its action is hip abduction and medial rotation of the femur. To experience these actions, we will be doing a side-lying series from Pilates. You may want a small towel or small pillow to place underneath your head and in between your arm for these. You will lie down on your side with both hips stacked and your top arm just in front of your lower ribs. Your bottom arm can be extended underneath you where you can place your small towel or pillow in between your head and your arm just to give your neck a little bit of support. From here, flex both feet, then lift your top leg up towards the sky, abducting the hip, and then carefully lower it back down to the mat. Lift the leg, lower the leg. Lift and lower. We're going to do 8 of these and make sure that your hips are not moving. So you don't want your side waist to get scrunched up, especially the side that's facing the ceiling. It's just the femur bone moving in the socket, and it's controlled by the gluteus medius. After you've completed about 8 repetitions, pause for a moment. Then lift your leg back up so it's just above hip height and kick it forward. From here, abduct your leg by lifting it up and then lowering it down. Lifting and then lowering. Do 8 repetitions here, keeping the hips very still. You can also bend your knee. Then bring your leg back, stack it on top of the bottom leg, and pause for a moment before we go to the other side. To come to the other side, make sure you set up the exact same way with the hips stacked and the top arm just in front of the low ribs. Then when you're ready, lift your top leg up towards the sky without shifting your hips, and then lower it back down. You're abducting your leg using the gluteus medius. Do 8 repetitions of these, keeping your hips very still and the side waists very long. Once you have completed 8 repetitions, pause for a moment. Then lift your leg up again just above hip height and kick the leg forward. From here, lift the leg up and lower it back down again. Do 8 repetitions lifting the leg and lowering the leg and keeping your hips very still. Lift and lower. If you need to, you can also bend your knee to do this. After you've completed 8, bring the leg back to stack on top of the bottom leg. The gracilis originates at the inferior ramus and body of the pubis. It inserts onto the proximal medial tibia, and the action of the gracilis is hip adduction and hip flexion, medial rotation of the femur bone, and knee flexion. To experience the actions of the gracilis, we will be doing another side lying series from Pilates. So lay down on your side with the hips stacked and your bottom arm stretched out so your head can rest on the arm. You can also place a pillow or a small towel between your arm and the head for some support. Now bend your top knee and draw your foot towards your hip. Place your foot flat on the mat just in front of your hip. And then take your top hand, thread it through the leg, and grab the outside of the ankle as shown. Make sure that both hips are stacked and both sides of your waist are equally long. If this position with the top leg is not available to you, you can bring the top leg down onto the mat as shown, so that your torso and your femur bone make a 90-degree angle. Choose the leg position that is most appropriate for you. Then energize your bottom leg. Make it very long. Then you will lift the bottom leg off of the mat and then lower it back down. Be sure to do this without shifting in your hips or your torso. Just the bottom leg lifts up and lowers down. You have 8 repetitions here. Lifting the leg, lowering it. Lift and lower, lift and lower, lift and lower. This time, lift the leg and keep it high and take small pulses with the heel. So you lift the leg up, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Keep it up and then slowly bring it back down to the mat. Go ahead and transition over to your second side. Be sure to take the same positioning on this side as you did on your first side. So make sure that your top leg is in the same positioning that you just had for your first side. Stack your hips and make both sides of the waist very long. Remember that the gracilis has 4 actions: hip adduction, hip flexion, medial rotation of the femur, and knee flexion. In this side lying series, we are experiencing the hip adduction action of the gracilis. So energize your bottom leg, then lift it off of the mat and lower it back down. Lift it up, lower it down. Do this without moving the hips or the torso, and notice how you can feel this action in the gracilis. Then keep your leg lifted and take small pulses up towards the sky, lifting the leg for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Lift it a little bit higher and then lower it all the way down to the mat. Now you can release your top leg alongside your bottom leg and rest. The gluteus maximus originates at the dorsal ilium, the sacrum, and the coccyx. It inserts onto the gluteal tuberosity of the femur bone and the iliotibial tract. Its action is hip extension. To experience hip extension, we will be doing Pilates swimming and Pilates grasshopper. So lay down on your stomach and have your hands one on top of the other with the elbows wide and then the forehead on the hands. Start by reaching your right leg long, then lift it off of the mat, and then slowly reach the right leg back down. Do the same thing on the left side. Start by reaching the leg long, and then slowly lift it off of the mat. This is hip extension. The gluteus maximus is working here. Make sure to draw your navel in towards your spine so that you don't take the action into your lower back. Lift your left leg off the mat and slowly lower it back down to the mat. This time, reach your right leg long, reach it off the mat, and then take small pulses up towards the sky for 8, 7, 6, 5, 4, 3, 2, and 1. Same thing on the left side. Lift the left leg off the mat and pulse it up towards the sky for 8, 7, 6, 5, 4, 3, 2, 1. Lower the leg all the way down to the mat. Now lift both legs long behind you and off of the mat. Reach them long, lift, 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 then slowly lower both legs down. Let's add the arms to come into full swimming. So reach both arms in front of you. On your exhale, reach both arms and legs long and lift them both off the mat. Then start to kick the legs up towards the sky and allow the arms to kick like you were swimming through water. So kick, 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 kick. Make sure you're lifting your legs a little higher each kick. Keep kicking, kicking like you're trying to swim away from a shark. Really feel how the glutes are working here to extend the hip. Then reach both arms and legs long and slowly lower your limbs back down to the mat. Another Pilates exercise that targets the gluteus maximus is grasshopper. So bring your hands underneath your forehead again. Bend your knees and glue your heels together. Make sure your knees are about as wide as your mat, and keep your lower back protected by lifting your navel up and towards your spine. From here, lift both legs off of your mat by trying to lift your heels closer towards the sky. Then bring both legs back down to the mat. Again, lift the legs off of the mat and slowly lower. You should feel the gluteus maximus working and contracting to lift the legs off of the mat. Do a total of 8 repetitions of grasshopper, lifting your legs off the mat and lowering them back down. Each time concentrating on how the gluteus maximus is contracting to extend the hip. After you've finished your 8th repetition, slowly lower the legs down to the mat and rest. The hamstring group is located at the back of the thigh and is made up of these 3 muscles: the semitendinosus, the semimembranosus, and the biceps femoris. These muscles share the actions of knee flexion and hip extension. Before we experience the actions of the hamstrings, let's first discuss the exact locations of these muscles. The semitendinosus originates at the ischial tuberosity. It inserts onto the medial proximal tibial shaft, and its action is hip extension, medial rotation of the femur bone, and knee flexion. An easy way to distinguish the location of the semitendinosus versus the semimembranosus is that the semitendinosus is on top of the semimembranosus. So tendinosus is on top. The semimembranosus is located underneath or deep to the semitendinosus. The semimembranosus also shares its origin and action with the semitendinosus. The insertion, however, is different. So the semimembranosus originates at the ischial tuberosity. It inserts onto the medial condyle of the tibia and the lateral condyle of the femur. And its action is hip extension, medial rotation of the femur bone, and knee flexion. The biceps femoris originates at the ischial tuberosity, the linea aspera, and the distal femur. It inserts onto the head of the fibula and the lateral condyle of the tibia. Its action is hip extension, lateral rotation of the femur, and knee flexion. Based on the origin and insertion of the biceps femoris, this muscle will be the most lateral of the 3 hamstring muscles. To experience the actions of the biceps femoris, the semitendinosus, and the semimembranosus, making up the hamstring group, we will be doing bridging, which is done in Pilates and yoga. So lay down on your mat, on your back, and have your feet flat on the mat with the knees bent, pointing up towards the ceiling. Separate your feet about hips distance apart, and bring your hands long by your side. To bridge the hips, lift your pelvis off of the mat and reach it up towards the sky. Then draw your pelvis towards your heels and feel how the back of the legs activate a little bit more and your spine gets a little bit longer. Then bring your hips back down to the mat with control. Use your exhale to lift your pelvis off of the mat again, reaching it up towards the sky. Stay here in this bridge for a few breaths. Reach your pelvis toward your heels and feel the back of the legs. Press your arms into the mat firmly and make sure there's no weight on your neck. Then use your exhale to bring your hips back down to the mat with control. Lift your hips up off the mat again, coming into your bridge position. Stay here for 2 long breaths, continuously activating your hamstrings to keep your pelvis off of the mat and the hips in extension and the knees flexed. Then bring your hips back down to the mat. Take a breath in. On your exhale, lift the pelvis back off of the mat, staying up here for 2 breaths. Then slowly roll through your spine and bring your pelvis back down to the mat. Lift the hips off of the mat again, coming into your bridge position. Stay here for 2 breaths, then slowly lower your pelvis back down to the mat. This time, as you come into your bridge position, prepare to hold it for 4 breaths, keeping the hips nice and high and reaching towards your heels, lengthening your spine, and noticing how the back of the legs are active. The hips are extended and the knees are flexed. Then roll through your spine and slowly lower your hips back down to the mat and rest. Now we will do a wide-legged forward fold from yoga to stretch the hamstrings and specifically become aware of the biceps femoris. This wide-legged forward fold is called Prasarita Padottanasana. Come onto your mat standing. Bring your hands onto your hips and then step your feet out wide. Draw your toes inward slightly and your heels outward slightly. This should medially rotate your femur bones. Then draw your navel in towards your spine. Keep the spine long and fold forward. Bring your hands down towards the ground so they're right underneath your shoulders. Now, if you need a little more help getting the floor closer to you, I suggest taking a block or a textbook or some blankets and placing them underneath your hands. You can also bend your knees slightly here, but we're trying to stretch the hamstrings. If you'd like to go further with your flexibility, you can fold forward and walk your hands so that they're in the same line as your feet. Choose the position that is most appropriate for you. Then notice in this position that the hips are flexed, the knees are extended, and the femur bones are medially rotated. These actions are the complete opposite of what the biceps femoris does, which is hip extension, knee flexion, and lateral rotation of the femur bone. So in this position, we are directly stretching our biceps femoris. To come out of this position, draw your navel in towards your spine, bring your hands onto your hips, and slowly reach your spine back up to standing on your inhale. Then you can heel-toe your feet back in underneath your hip sockets and come back to your standing position. The biceps brachii originate at the coracoid process of the scapula and the supraglenoid tubercle of the scapula. The biceps insert onto the radial tuberosity of the radius, and the action is elbow flexion and supination of the forearm. Another muscle that performs elbow flexion is the brachialis. The brachialis originates at the distal anterior humerus and inserts onto the coronoid process of the ulna. Its action is elbow flexion. A third muscle that performs elbow flexion is the brachioradialis. The brachioradialis originates at the lateral distal humerus and inserts onto the styloid process of the radius. The action of the brachioradialis is elbow flexion. It also assists in pronation and supination of the forearm. The triceps brachii originate at the infraglenoid tubercle of the scapula, as well as the medial and posterior humerus. The triceps insert onto the olecranon of the ulna, and the action of the triceps is elbow extension. The biceps brachii, the brachialis, and the brachioradialis all perform elbow flexion. The triceps brachii performs elbow extension. These two actions can be performed in the same exercise. We will be doing a modified push-up that is used in yoga and Pilates to experience these actions and to become more aware of these four muscles. Come onto your hands and your knees. Have your shoulders over your wrists, and then stretch your right leg long behind you. Then reach your left leg long behind you, coming into a plank position. Then bring your knees down to the mat and shift your hips forward so you make a long line from the crown of your head to your knees. Now bend your elbows to 90 degrees and then press yourself back up, flexing the elbows and extending the elbows. Flex the elbows using the biceps, the brachialis, and the brachioradialis. And then to extend the elbows, you're using your triceps. If you'd like a little bit more of a challenge, lift your knees off of the mat, coming into a plank position. Then shift forward and do the same exercise, flexing the elbows and then extending the elbows. Do 5 push-ups here. After your 5th push-up, reach the hips up and back and come into a downward facing dog position to rest. Try doing 2 more sets of 5 push-ups to become more aware of these 4 muscles. The tibialis anterior originates at the lateral condyle of the proximal tibia, so the part of the tibia that's closest to the head. It inserts onto the first metatarsal bone. Its action is dorsiflexion of the ankle. To experience dorsiflexion of the ankle, we will be doing staff pose or dandasana from yoga. So come to a seated position on your mat with your legs long in front of you. Bring your hands right next to your hips, draw your navel in toward your spine, and think of sitting very tall. To dorsiflex the ankle, draw your toes towards your chest and reach your heels forward to the wall in front of you. Then release this. Try again. Flex your ankle by drawing your toes towards your chest and reaching your heels forward. Notice how the tibialis anterior is contracted in this position. Then release this again. Do a total of 10 repetitions dorsiflexing the ankle, holding for a moment, and then releasing again. This seated position, with the feet dorsiflexed and the spine reaching tall towards the sky, is Dandasana, staff pose from yoga. Once you have completed your 10th repetition, relax the ankles and the tibialis anterior and rest. Thank you for participating with the Living Anatomy. I hope you've enjoyed your experiences. Feel free to take a few moments and jot down any notes you have about the muscles we have experienced. Good luck on your upcoming practical examinations, and have a great day. Thanks for watching.